Hello, and welcome to Nephrology Nursing Perspectives, an official podcast of the American Nephrology Nurses Association. This podcast provides interviews and discussions between ANNA members and the nephrology community. The podcast focuses on nephrology nurses' issues, health policy, and nephrology nursing as a specialty nursing profession in the areas of conservative management, peritoneal dialysis, hemodialysis, continuous kidney replacement therapies, acute kidney injury, transplantation, vendors, and government and regulatory agencies. In this episode, Ms. Lillian Pryor, the 2020-2021 president of the American Nephrology Nurses Association, talks with Ms. Teresa Villaran, a staff nurse with Fresenius Kidney Care and a leader within the American Nephrology Nurses Association and the Kentucky Nurses Association. What does advocacy mean to you? In this episode, Ms. Villaran discusses why it is important for nurses to become advocates for their profession and patients. She encourages nurses to use their collective voice to influence and advocate for policy and healthcare legislation at the local, state, and federal levels. She advises nurses to develop your story and make sure legislators know your name and that you are a nurse. We are pleased to present Lillian Pryor's interview with Teresa Villaran.
Hello, everyone. This is Lillian Pryor, immediate past president of the American Nephrology Nurses Association, and I am ready for our next Nephrology Nursing Perspectives podcast session. I am here today, and I am so excited. I have Teresa Villaran from the Bluegrass Chapter. She is actually the president of ANNA Bluegrass Chapter in Kentucky. She is chair of the Kentucky Nurses Professional Nurse Practices and Advocacy Cabinet Education. She is on the board of directors for the Kentucky Nurses Association, and she is an ANNA member long time in the 90s, and then now she's just kind of re-motivating herself. And so for the past 4 years, she's been more involved and really involved, particularly with advocacy, which is our topic for today. So hello, Teresa.
Hello. Thank you for having me.
Absolutely. How are you doing today? How's everything in Kentucky?
It's great. We're having some storms, but we're over all that now. So I think the sun's trying to peek through.
All right, nice. I'm going to just open us up a little bit, and I'm going to ask just a question. Are your thoughts about advocacy and nursing? What does advocacy mean to you, and why are you so interested, or what interests you the most about advocacy? What does that mean to you?
Well, I'd like to start by maybe defining advocacy just so that we're all on the same page. According to the American Nurse Association, advocacy is the act or process of pleading for, supporting, or recommending a cause or course of action. And advocacy can take place wherever health consumers exist or their needs require representation. So we're all on the same page. But for me, advocacy means different things for different people. You might advocate for patients, families, communities, and helping them meet their individual or collective needs, like safe housing, clean water, getting vaccines to everyone in a pandemic, or even just getting free rides to dialysis treatments. It also can be advocating for nurses or the nursing profession in general. If your state doesn't have it, maybe you can advocate for full practice authority for nurse practitioners, or workplace safety and violence prevention within your workplace itself, or actually getting state legislation to prevent violence in the workplace. We can advocate for policies that promote fairness and equity. And this is an area where nurses can really work. Nurses can be the experts to those people who write the policies. We can actually be the ones to write the policies even, because who knows about the equity issues that we have with our patients more than we do. Right. But even if we're just making our voices heard about good or even bad policies, legislators need to hear from nurses. We can also advocate for change of any sort, from workflow issues in the workplace to sitting on boards of nursing to running for local government. We can advocate for system change. The worst thing you can hear is we've always done things this way, when really nurses should be asking ourselves, why are we doing things this way, especially if those things aren't working? So as you can see, advocacy takes many forms. Nurses say, I'm just a nurse. What can one nurse do? But remember, we are one voice in over 4 million voices. If we can cultivate our message, then nursing's voice can be very powerful.
That's awesome. That is so awesome. And I can hear the passion that you have and just the conviction in terms of advocacy in nursing. It kind of went into my next question that I wanted to ask, and you've already actually answered it. And the question was, do you think nurses can be effective advocates? And then give me an example. So some of the examples you've already given me start with just policies, right? Policies where if you don't have the full authority to practice for nurse practitioners in your state, how do you advocate for that to get that policy changed so that you can have the ability to practice for the full extent of your license? Even within your dialysis units, if there are practices, and I love what you said, when you said, instead of saying something like, we've always done this before, that's like just the wrong statement, right? What
Exactly.
What we should be saying is, okay, this is not working, and how can we change it, and how can we make it better? I just love that. You've given so many examples. Now, is there one thing that's really, really close to your heart in terms of an example that you've advocated for, and how did you go about doing that?
With our state Living Donor Protection Acts, I'm not a living donor, but I do support the act. And we have a really good example of somebody who donated her kidney to someone that she just read their story online in her neighborhood, like Facebook page. And they were asking for someone to donate for their son. And she didn't know these people, went out and donated her kidney. And when we went to our legislators to talk about this LDPA, I went over the bill. I went over why it's important, why it should get passed, but she's the one that had the story. So we can lead our own advocacy, but we also can support the advocacy of others.
Okay. And that's super important, particularly now, because the Advancing American Kidney Health has brought forth a lot of flurry, if you will, and motivation in the nephrology space, where prior to, there hasn't really been a lot of movement, I would say. I know behind the scenes probably, and we certainly have many organizations, AAKP, NKF, KCP, advocating for things behind the scene. But in 2019, I think that was kind of brought to the forefront. And so from where you're standing, how do you think it's important now for nephrology nurses to be involved in that advocacy effort?
Advocacy is important for nephrology nurses because we see the needs of our patients firsthand. We see inequities just within our own specialty. Black patients make up 35% of patients on dialysis, but are only 13% of the general population. There are approximately 5,800 end-stage kidney disease cases per million for Black Americans versus 1,700 cases per million for white Americans. So social determinants of health, or I heard a speaker call them political determinants of health, and I loved that. Political determinants of health impact all patients in some way or another. We didn't just get where we are today with disparities in chronic kidney disease, diabetes, hypertension, Black mother mortality. We got here on purpose with the legislation that we either passed or even those that we did not pass.
Okay.
One example is advocating for Medicaid expansion at the state level. And you say, well, I'm just a nurse. Why am I going to advocate for Medicaid expansion? Well, 12 states have not passed Medicaid expansion. And we have study after study that shows how Medicaid is a life changer in offering people access to life-saving healthcare and services that can impact the ability to be healthy. These services can mean the progression through stages of chronic kidney disease can be altered to slow the disease and prevent patients from needing dialysis. We just have to advocate for these services and also for providers to accept this type of insurance. I also want to say that advocacy just isn't even important for me or an individual. The American Nurse Association just added advocacy to the 4th edition of the Scope and Standards of Nursing Practice. So it must be pretty important.
Absolutely. And I think the only way that changes have been made, CMS, Health and Human Services, has been because of advocacy efforts. It's probably the only way that we're able to move policies that affect this United States in healthcare. I am so happy to hear you talk about those social determinants of health in terms of policies, because I don't know, it's like, don't kid yourself and say that nurses are not political. And I don't know if I'm saying that right, but I think it's almost the very essence of what we do.
Yes.
We advocate, right, for our patients.
I think nursing is fundamentally political. The American Nurse Association was developed in 1911 to support and address issues that affect nursing.
Mm-hmm.
And they started with lobbying for 8-hour workdays in 1934, the Fair Pay Act of 1995, and even getting nurses PPE in a pandemic. What we need, though, I think, is nursing to give the tools and language to advocate effectively for nurses. We need to be deliberate in the issues we choose to support and collaborate with others to raise our voice and demonstrate our credibility.
I agree. Because we are very, very credible for the last, I don't know how many years, 15 years, 16, 18 years, we've been voted as the most trusted profession.
That's right.
And so, as you alluded to earlier, 4 million strong, we have a voice that we can use to influence and advocate for policies specifically, and overall just to make healthcare a better vehicle, to make it more accessible for people, to make it just better, I think, in general. Now, nephrology specific, how can we as nephrology nurses get more information about what we can do? What would be one of the resources that you would give to us so that we can get more involved in advocacy and just learn more about it? Because I know maybe some of us, and I know for myself personally, it just seems so
daunting.
I
think as an association or with any nursing organization, we must make it very easy for nurses to advocate. We need to give them the tools, like give them a one-page flyer that they can use as talking points, but that they can also hand to their legislators so that the legislator can read back later when they're trying to decide whether to vote for a piece of legislation or not. Mm-hmm. We need to make sure that everyone's using the same talking points because it gives us credibility as a profession, as an association. We also need to support state and federal policy issues because we have nurses at the state and patients at the state level too. I know that as an association, we tend to be more willing to support federal policy, but we also need to consider supporting state policy. But some things that ANNA offers is the Legislative Action Center, which guides nurses in how to support ANNA legislative priorities. With a couple of clicks, you can send a letter to your congressman or senator telling them that you support a piece of legislation. We also offer the Capitol Hill updates that keep us abreast of what's happening in Washington, D.C. And there's a lot happening in Washington, D.C. These are updated every single day. They tell us what's going on, what pieces of the legislation are moving or not moving. That's a great way to keep abreast of what's going on. And there's also a legislative tracking chart that members can look at that's on the website. There are many bills listed on the chart, like workplace violence, Black Maternal Health Momnibus Act of 2021, which is sponsored by Representative Lauren Underwood from Illinois, who is a nurse.
Right.
So I just bring up this chart because it's an example of how nurses can get involved. The chart indicates which bills ANNA supports. It also indicates if there's not a House or Senate bill associated with it. So nurses can contact their legislators, see if they would be willing to support that bill. If the nurse, thinks it's important for nursing or our patient population, nurses can discuss why they support the bill, educate the legislator on the bill. Get a commitment to support the bill that the nurse thinks is needed. Take some friends with you because legislators like seeing numbers of constituents. It means that people are really, really interested. Follow up with your legislator about the meeting that you have with them. It shows that you really care. My thing is that legislators should know your name and that you are a nurse.
Oh, that's powerful. That's powerful right there. I'm writing that down for myself. I plan to do some advocacy here. I'm in the state of Georgia. You've just brought so much out just in this few minutes that I've been able to spend with you. I want to just say thank you for agreeing to spend a little time and talk with me about this. You've given us some great resources, particularly from the ANNA website, annanurse.org. I look forward to just reading more of your posts on ANNA Connected, but we also have, what is the specifically for the Health Policy Committee?
The Advocacy News and Alerts on ANNA Connected.
I am just so thrilled that we are in such a time as this. As nurses, we do have a voice. It's so important to remember that we can influence and we should influence for the betterment of the United States and our healthcare system.
Yeah.
Do you have any final words you'd like to say?
My final words would be create your story around a legislation that you support. Your story is more powerful than anything else that you can tell a legislator. That shows them how these issues affect their constituents. Mm-hmm. So developing your story is the most powerful thing that you can do. And then meet with your legislators. Literally, you can contact them on social media. Some of them give out their phone numbers, some of them emails, some of them will meet with you for coffee. That's why I say create your story and make sure they know your name as a nurse.
That's powerful. Teresa, thank you so much for spending some time with me again. Like I said, I look forward to just seeing and reading more of your posts and keeping me abreast and up to date on just legislative happenings and just things that are important to nursing in general, and then important to nephrology nursing specifically.
Well, thank you so much for having me.
Absolutely. And now that's all we have for this episode of Nephrology Nursing Perspectives. Good night.
Nephrology Nursing Perspectives is owned and produced by the American Nephrology Nurses Association, all rights reserved. No portion of this podcast may be used without written permission. Ms. Teresa Villaran is a staff nurse with Fresenius Kidney Care. She is the president of the ANNA Bluegrass Chapter, a member of the ANNA Health Policy Committee, and serves on the Manuscript Review Panel for the Nephrology Nursing Journal. She is the current chair of the Kentucky Nurses Association Professional Nursing Practice and Advocacy Cabinet and serves on the 2019-2021 Kentucky Nurses Association Board of Directors. She is a board member of the St. John's College of Nursing Alumni Association. She has served as an advocate the past 2 years at the National Kidney Foundation Patient Summit. She is currently a member of the National Kidney Foundation State Chronic Kidney Disease Task Force Living Donor Protection Act Coalition. She has been active this year in delivering mass COVID-19 vaccinations for the Louisville Health Department. She attended the American Nurses Association 2021 Hill Day and the Nurse in Washington Internship as a grant through ANNA. She currently sits on the Kentucky Nurses Association task force charged with creating a legislative and leadership academy to increase nurses' confidence and competence to exert their influence through policy. Ms. Lillian Pryor is a renal clinical nurse at the Atlanta VA Medical Center in Decatur, Georgia. A member of the American Nephrology Nurses Association since 1990, Ms. Pryor has served in roles that include President-elect, ANNA Director, ANNA Awards and Scholarships Committee Chairperson, ANNA Representative to the Kidney Health Initiative Patient Preference Task Force, and an author and peer reviewer for the Nephrology Nursing Journal. Ms. Pryor served as the 2020-2021 President of the American Nephrology Nurses Association. In addition, she is an active member of ANNA's Dogwood chapter in Georgia and has served the chapter as both its president and health policy representative. For archived episodes of Nephrology Nursing Perspectives and to learn more about the American Nephrology Nurses Association, visit annanurse.org. You can also subscribe to this podcast on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found.